pain solutions on this show, I'm going to talk about 4 recent cases of hip pain. I'll talk about what we did to make their situations better. 2 of the cases are people, runners, and 2 of them are not runners, and very different ages as well. So I want to talk about what we did, and then we're going to talk about some solutions for you if you're having hip pain at home, maybe some prevention strategies as well. The first one is a 23-year-old woman. She's a runner, and she's had hip soreness, right hip soreness, for 2 to 3 years. She gets it after long runs and after marathons, okay? So at rest, she doesn't have any pain, and shorter runs, no pain, only when she goes long. Okay, so that prompted her to come in and see me, and we're doing an examination. She had already had some x-rays taken at another facility. We looked at those, and I looked at her posture. So here she is with right hip pain, and I saw that her right leg was long. I always go by the short leg, so her left leg is short, okay? Well, that's going to be a problem. Looking at the model, if this right leg is long, you can see what that's going to do here to the pelvis, but also to the hip ball and socket joint. And by the way, the hip is actually out here on the side. So if we have pain on the back side here, it typically is not hip per se. It could be, but it's usually right out here on the side. She also had pain that would radiate down the side, giving like an iliotibial band syndrome symptom, but it absolutely was not that. So here she is with a long leg on this side. We identified that on x-ray and in posture and examination with leg checks on the table. Okay, so we started fitting her with a lift over here. And she was about 10 millimeters off, or 2/5 of an inch off. So what I do is I shim the opposite side for a while. Now that's not the only thing I do, because if I just shim this and wait, it's going to take time for all the tissues to adapt and heal. So we can speed that along with our chiropractic techniques, our soft tissue techniques, and so forth. So I'm working tissues in the front of the thigh, the side, the back. Now look at the alignment of the spine when we lift that up there as well. So you can see the spine is out of alignment now. That's going to create some tension and torsion in here, and also interfere with the signaling from the hip joint and all the surrounding muscles into the spinal cord and brain, and then the brain and spinal cord back into this area. So I'm not going to let her I'm not going to work just on the hip. I'm going to also work on the lumbar spine, actually the entire spine, but we'll say in this case the lumbar spine. So we start evening this out with a lift. We start evening it out with the chiropractic adjustments. We start working on the spine to improve that. She gets exercises for the lower back and for the hip. And sure enough, after 7 visits to my office, she's 80% better. She had some spinal stuff too, so actually her hip was even better than that, because on long runs, she's not feeling her hip at all. Nice situation. She's really happy, and she is training for the Boston Marathon here in 2020, so she's going to have a much nicer time with that. Second one was also a runner, a 41-year-old woman. In this case, she has left hip pain, lateral hip pain here. It started 2 months earlier. It was a sudden onset. She didn't know why she did it. Okay. And she had pain that went down the side of the leg as well, thinking again of an iliotibial band syndrome. She had an orthopedic appointment with a brief examination. The orthopedist said, I just want you to take some time off and stretch. So not a lot was gained there. She tried that, and it wasn't getting better. Another patient of mine said, hey, go to Fuller. So she comes in. I diagnosed, I saw this on x-ray. She only had a 4 millimeter short right leg, so not much, an eighth of an inch, right? So she's off a little bit here. We tried a heel lift. Here she is opposite of the other case. She's a little high on this left side. We try a heel lift underneath the right foot. She didn't respond well to it, so we actually stopped. Not everybody responds positively to a heel lift, even if they have a diagnosed short or long leg on x-ray, on examination, on posture. So she didn't respond to that, but she responded great to all the other techniques that we did, working the tissues all the way from the hip to the knee, on the front of the leg, side, back side of the leg. And of course, once again, we started addressing her lumbar spine, her lower back, to take pressure off the tissues here, nerve communication from that area to the brain, from the brain back to that area. And sure enough, after 15 visits, she is 95% better, back working out, back running. She's doing great. Okay. The next one is a woman that just started to come see me. She is 65 years old. In December of 2019, she moved a dresser. So she was pushing on a dresser. 2 days later, so there was a little delayed response, and it took me a while to pepper her to find out what caused it. She woke up and had terrible hip pain on the right. It was her back and her hip and her leg. So initially, before she came to see me, everyone was thinking it was her lower back, okay? So when she came in to see me, I wasn't convinced, and we started talking about it. I said, did you do anything differently? Because it was end of December, around the holiday season. I said, were you putting decorations or boxes up high in a closet or the attic or something like that, or in the garage? She said, no, I wasn't doing that. And then it finally dawned on her after we talked about it for a while. I moved a dresser. I had to push on a dresser 2 days before this pain started. Like, very likely that was it. Now, when she was at her doctor's office, she received x-rays. I haven't had a chance to see the x-rays yet. They're just slow to getting to us. But she was told she has arthritis. Take pills, and they scheduled her for an injection. So she's taking the pills, but she didn't want to have the injection. She ends up in my office. So I'm doing my examination. I'm doing these checks and orthopedic tests on her hip, and her hip can almost not move at all. I can barely turn it one way. I can barely turn it another. If I bend that hip and leg up and try to turn it this way or that way, almost like a figure four, almost 0 degrees of motion, and she saw stars, okay? So now I'm thinking, this is more of a hip problem, and the hip is radiating pain down the leg, and the lower back could be a component in this, meaning the lower back could be inflamed as well, but boy, it just seemed like it was a hip problem, right? So, looking at her posture, here she is, right hip pain, and that hip is way up on that right side. And you could see by the way she was walking, right? And she was walking with a terrible limp. She could barely put pressure on that side as well. That's how bad it was in the beginning. Now, she's 65 years old, and I'm looking at her, and I'm looking at this situation thinking, oh my goodness, I really hope I can help her. This would be really something. But I'm thinking, likely there's a lot of osteoarthritis in there because that joint wasn't moving at all, right? So we try our best. So I start doing my work. We do some hip work, same as the other cases that I talked about. Tissue work on the front, on the side, on the back. We're having her ice at home. I'm having her do some back stretches. She couldn't do any hip stretches because anything would set her off. So we said no to stretches. And we're working on her. Her pain is 7 to 10 over 10. She would tell you it's a 20 at times. It's a 20. 6 visits later, so we're seeing her 3 times a week right now. 6 visits later, she just walked into my office yesterday with just a slight limp. It was unbelievable. I couldn't believe the changes. Now, when I finally see the x-rays, are we going to see osteoarthritis in the hip? Very likely. Are we going to be removing that arthritis? Absolutely not. But we're taking her from complete dysfunction into functioning. Is she going to need an injection? I don't know. She asks me, I don't know. Is she going to need a hip replacement? Unsure at this point. We're unsure. But if we can gain her some time and some life, and a lot of people that have been told that they need hip replacements, they'll come in and see me. I have people in their 40s told that they need hip replacements, but they're coming to see me on a regular basis with very important strategies at home as well. And as we do these strategies, we're trying to gain time. We're trying to help these people put that off. Maybe it's a year, maybe it's 10, maybe it's 15, maybe it's never. So we're trying to gain that in this case, but what a great relief. She couldn't even sleep at night. The pain was so bad. Last case, 17-year-old female now comes in to see me. She has lower back aches for a year off and on. When she sits, her lower back aches. So it was more of a lower back problem first, but then her right hip started hurting her off and on a 10 scale, it was 5 to 6 over 10 at times, not all the time, okay? Now, here she is in my office with Mom. Mom's already a patient of mine. Mom said, you need to go see Fuller, at least have an evaluation. Let's see what we can do. So she's standing like this, and you should see, I remember I could see it. The right hip was up like this. You didn't even need an x-ray. You didn't need a measuring tape, nothing. As soon as I saw that, I saw, Mom, come on over and take a look at this. And I asked her, do you see a hip that's higher than the other? And Mom says, that one, absolutely. It's up like this. And the daughter confirmed and says, when I get things tailored, or if I have slacks or whatever, on the short leg side, the left side, that always wears down first. And there's a little secret there for you. You'll notice that the wear in your shoes will be different. It'll be on the outside of the heel of the short leg typically. And I know that because I've seen that on myself. You'll see that the tailor has to do a little bit more work on your clothing if things are being customized. You'll notice that the bottom cuff on the short leg side will wear down because it's scraping on things a lot easier, and so on and so on. Okay? Other people can look at you and take an analysis as well. So we've just started to see her, the 17-year-old. We're only 2 visits in. She already has a little bit of relief. We already started her with a heel lift. Now, we calculated her out 16 millimeters off. So she is 16 millimeters like this, 2/3 of an inch, pretty significant. The worst I've seen is an inch. She's 2/3 of an inch off. So I'm starting to shim up this left side. I don't start with 16 millimeters or 10 millimeters. I start everyone with 3. I put in a 3 millimeter lift, her hips get sore. Her hips got sore only after 3 millimeters because it needed to adapt. So she took it out for a little while, put it back in, took it out. Then she was able to get through the entire day and actually felt quite good with the lift. So the next time I see her, we're going to go to 5 millimeters and continue building up. And you best believe, because her spine is off, because the hip is so much off, her spine looks just like this on x-ray. It's all bent out of alignment. So we're going to be working on that by working on the legs, and that's going to relieve the hip. We're going to work the tissues around the hip, and so forth. 4 cases. I expect that she's going to turn out well. We don't have any new news on her yet. It's only been 2 visits, but the other 3 have turned out really well. So what do we recommend? What do we recommend that you can do for hip pain? Get the proper evaluation and examination. You can see here that these folks, when they came in to see me, they're getting a full body, full spine, and then hip examination, orthopedic test, neurological test, and so forth, x-rays if necessary, and that's helping us out a lot. So get an examination. Second is consider a chiropractic examination. So the chiropractic evaluation can add different dynamics, as I described here, to maybe help your problem a little bit more. Avoid overstretching. This is the third thing. So a lot of people, when we do help, maybe it will go away. Those 5 words, right? Maybe it will go away. And oftentimes a lot of things do go away on their own. But if they don't, a lot of people will be stretching their hip intensely, and that isn't necessarily a good thing. It's like stretching or overstretching a sprained ankle. So just be careful with overstretching. I always tell people, do things within the comfort zone, not into the pain zone. If somebody said, and this happened to several of these 4, somebody says, this stretch worked for me, and you try that stretch, and it's not working for you, then it's off the list until you get a consultation with a physical therapist, with a chiropractor, with a physiatrist, whatever it might be, who you're going to be working with. Avoid painful exercises, number 4. Again, if you're at the gym and you're a workout person, or maybe you're a runner like these folks here, you just might need a break. One of the runners needed a break. She actually did a cross training, did some other stuff that was comfortable. She found the bike was fine, the elliptical was fine, running was not. So she had to stop with the running until she repaired and healed. Then she could go back to running. So avoid painful exercises. Definitely use ice. If something is 2 days old or 2 months old, if it hurts, you've got inflammation. Ice is anti-inflammatory. Don't over ice. Make sure that make sure you're okay to use ice. You don't have a circulation problem. 20 minutes on with ice, at least 2 hours off before you do it again, and don't put ice directly against your skin. And lastly, which worked for 2 of these 4 people, yoga. Now, yoga doesn't work for everybody because it can be overstretching. And if you try some yoga stretches once again and it hurts, either back off, modify, eliminate. Okay? But for some of these folks, they're doing lots of strength training, lots of running and so forth, but they don't have enough flexibility, and they find that some yoga works, maybe a formal yoga class, or maybe just developing 6 or 8 or 10 yoga stretches that seem to work for you. So this is a list of things that you can try here to try to help your hips. Again, get the appropriate consultation and examination. I'm Dr. Scott Fuller.